What if someone suddenly collapses in front of you? Every minute without CPR reduces their chance of survival by about 10%. The good news? You don't have to be a doctor to save a life.
First, make sure the area is safe. Check if the person responds by tapping their shoulders and shouting, "Are you okay?" If there is no response, and they're not breathing normally or only gasping, call your local emergency number immediately or ask someone nearby to call and bring an AED if available.
Now begin CPR. Place the heel of one hand in the center of the chest. Place your other hand on top, lock your elbows, and push hard and fast. Compress the chest 5 to 6 centimeters deep at a rate of 100 to 120 compressions per minute. Let the chest rise completely after each compression.
If you're not trained in rescue breathing, continue with hands-only CPR until emergency responders arrive or an AED is ready. If an AED arrives, turn it on and carefully follow the voice instructions. It can analyze the heart rhythm and guide you safely. Remember these 3 steps. Call for help. Push hard and fast. Use an AED if available. Your quick action could keep blood flowing to the brain and heart until professional help arrives. Greetings. Stay informed, stay prepared, and you may one day save a life.